y'all, it's Dr. Harper. I want to talk to you about some really common medical problems that I see as a physician that can definitely affect sexual function and sexual desire. The most common problem that women have that's associated with sexual problems is anxiety and depression. This is actually the most common thing that we see together, and because of that, I'm going to have a whole separate video that will go into that a little bit more deeply. Another really common thing that we hear about, especially in older patients, is arthritis. So arthritis is pain in your joints that can really affect your mobility and your range of movement. So when you're having trouble with arthritis, it can clearly affect your sexual ability, your sexual function, and because of that, it might also affect your desire. So if you're having trouble with arthritis or you're just now developing symptoms, it's something to see your physician about so that you can get those symptoms feeling better before they progress. Another common thing that we hear about is if you're having trouble with leaking urine. So that's called incontinence of urine. So when you have had babies before, you might have experienced this. Usually the symptoms get better within the first few months, but if they persist and you're leaking urine when you're not meaning to, that can clearly affect, how you function sexually, and then it also might affect your desire. So if you're having trouble with leaking of urine, know that there are lots of things that we can do to help you with that, and start to talk to your doctor more so that she or he can help you. Another really common issue that we hear about are patients who are having tummy troubles. So if you have IBS, Crohn's disease, an undiagnosed food allergy or sensitivity, that can cause frequent bloating, gas, diarrhea, constipation, all over the map. And being uncomfortable in your stomach can really affect how you perform and how you feel in the bedroom. So if you're having those symptoms on a recurrent basis, that's definitely something to call your physician about so that you guys can get those symptoms figured out before it has a long-lasting effect on your sexual relationship. Another thing that I found in practice that's really changed the way that my patients think about sex is when they're diagnosed with a sexually transmitted infection. So if a patient finds out that she has a new diagnosis of herpes or maybe HPV or really anything that's transmitted sexually, it might affect how she feels physically, but also how she thinks about sex mentally. She maybe used to think about it as pleasurable and fun, but now she thinks about it as dangerous and scary. And so it's really worth some talking through with either your doctor or a therapist to realize that, sex really is pleasurable and fun and you don't have to be scared of it because of an infection. If you're experiencing any of these symptoms, or maybe you already have one of these diagnoses and you feel like your symptoms could be better, I would really encourage you to reach out to the doctor that's taking care of that problem for you so that you guys can both address the issues, and then that can help you feel better on a day-to-day basis and also help you to feel better in the bedroom.